Greetings. Today I'll be discussing Peptides Made Simple, a no-nonsense guide to getting the results you want. You don't need to memorize 100 peptide names and their functions. You only need to know the 3 to 4 that will actually move the needle for your specific goal. Here's the straight-to-the-point breakdown we give every new client at Age Reversal Technology Center. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, also known as the Nutrition Ninja Doc, founder of MyBodySymphony.com and the STEM Region/Age Reversal Technology Center, ARTC.Health. He is a problem solver with a focus on helping people overcome their health challenges and achieve their health, performance, and appearance goals. He is using this avatar to save time making videos that can be better spent helping people. My role as his avatar is to convey his knowledge and insights about health, healing, and regeneration. Please note that I'm an avatar of a doctor, and none of the information I convey should be considered medical advice. It is intended for educational and entertainment purposes only. Consult your trusted healthcare provider before making any significant changes to your health regimen. Doc Max also provides individual supervision, in person or virtual. Contact us at 9418-065-511 to learn more. Now let's get back to today's topic. Before that, I ask that you leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way to help get these health-related presentations out to more people. If your goal is serious fat loss while keeping or even gaining muscle, the new king is retatrutide, which has surpassed semaglutide or tirzepatide in results and benefits. These are the GLP-1 peptides that have taken the world of weight loss by storm. Retatrutide is the third generation and packs more punch than the other two by a long shot. Now pair that with tesamorelin or the CJC 1295/ipamorelin combo at night, and people routinely drop 20 to 40 pounds of pure fat in 4 to 6 months with zero muscle loss. The New England Journal of Medicine and Lancet studies back up 15 to 22% body weight loss on these alone. If you want to heal an old injury, leaky gut, or stubborn tendinitis, or basically anything that won't get better, the combination everyone calls the Wolverine stack is BPC 157 plus TB 500 is for you. Most people feel a difference in 2 to 4 weeks and are shocked at how fast things finally heal after years of being stuck. For deeper sleep and next-day recovery, DSIP before bed or Epithalon cycles combined with CJC 1295 IPAM turns restless nights into waking up feeling 10 years younger, usually noticeable within 5 to 14 days. Want younger skin, thicker hair, and that glow people keep asking about? GHKQ, the copper peptide, is the single best option. Use a little bit injected or high-strength topical every day, and within 8 to 12 weeks, collagen production can jump 70% or more. That's straight from published molecular science research. Caveat, injected GHKQ can cause local tenderness and pain for a day or longer. It must be the copper. I've come up with an alternative that uses liposomal delivery to allow for oral or topical application. If neuropathy or nerve pain from diabetes, chemotherapy, sarcoidosis, or long COVID is ruining your life, ARA-290, also called sabinitide, or high-dose BPC 157 near the affected area is giving people their lives back. Phase 2 trials show 50% plus pain reduction and actual nerve regrowth in months. Many of our clients taper off gabapentin and Lyrica completely. To bulletproof your immune system and finally clear chronic infections or lingering viruses, thymosin alpha-1 combined with LL37 is the gold standard. It's already approved in over 35 countries, and the long COVID data coming out now is extremely promising. If you just want your own growth hormone to go up naturally without daily GH shots, CJC 1295 plus ipamorelin or straight tesamorelin can increase your 24-hour GH output 200 to 1,000% within weeks. And if brain fog, anxiety, or poor focus is the problem, the Russian nootropics C-Max and Solank as nasal sprays work ridiculously fast. Most people feel sharper in 3 to 10 days. Add dihexa if you want aggressive neuroregeneration. The simple rule that saves you thousands. Pick one main peptide for your primary goal, add BPC 157 for healing and recovery, and one sleep or immune peptide only if you need it. 3 at once is the sweet spot. More than that, and you're likely wasting money. Fat loss stack. Retatrutide or Tirzepatide once weekly plus tesamorelin at night, plus oral BPC 157 capsules, over 50 total rebuild. CJC Shipamorelin plus BPC 157 plus GHKQ plus thymosin alpha 1. Neuropathy reversal. ARA-290 daily plus local BPC 157 plus GHKCU. You can try to figure all this out on your own, and plenty of people do, but most waste a lot of time and money on fake products or the wrong doses. That's exactly why we created the Peptide Coaching Program at Age Reversal Technology Center. You get lab review, a custom protocol built only for your goal and blood work, pharmaceutical-grade peptides that are third-party tested, and weekly check-ins with a clinician who lives and breathes this stuff. If you're ready to stop guessing and actually get the results you've been reading about, call or text us right now at 941-806-5511. Your first 10-minute phone consult is completely free, no pressure, no sales pitch. We'll just tell you straight whether peptides can help you and exactly which ones make sense. Age Reversal Technology Center, 941-806-5511, 6968, Professional Parkway, Lakewood Ranch, Florida. Nationwide telehealth available. One phone call can change the next 10 years of your life. Make it today.